Oh my God, somebody help me.
Ma'am, are you okay?
No, I think I
need a wheelchair.
Oh my goodness.
Let's get you to a room.
Please help me, wife, please.
All right, I'm just gonna raise you up just a little bit. Okay. You okay? All right, can you sit up at all?
Yeah.
You need help? Okay.
I can't hardly see.
You can't see?
Yes.
Okay. Well, that's the first thing I'm going to check, okay? I'm going to check to see if your pupils constrict, okay? Can you get your legs across? Can you move?
Not this side.
No? Okay. Hey.
Hey, Nancy, I figured you might need some help.
Yeah, she's having some weakness on this side, so I think it would be better if you could just be there, just in case.
Sure, no problem.
All right, Miss Cooper. The first thing I'm gonna do is I'm going to check make sure your pupils constrict. So I'm gonna check for your optic nerve.
Cranial nerve number 2 is the optic nerve. This nerve involves the sense of sight. This nerve is responsible for transmitting visual sensory information from the retina to the brain. Optic nerve atrophy is damage to the optic nerve. This is caused by poor circulation in blood vessels that supply the front portion of the optic nerve. Damage to the nerve could cause temporary or permanent blindness. Loss of visual field in both eyes can indicate a lesion of the opposite side of the optic tract, similar to that of a cerebrovascular accident. Okay. Ready?
Mm-hmm. All right, that looks good. And the next thing that I'm going to check for is to make sure that you can follow my pen, okay? And this will be testing the ocular motor nerve. And I want you to follow my pen, okay? It's going to go towards your nose. Okay. Are you okay? You sure? Okay. The next thing that I'm going to test is your olfactory nerve.
P.U., what's that smell? The olfactory nerve is the first cranial nerve. It is only one of 2 nerves that does not join the brainstem. It is also the shortest of the cranial nerves. Damage to the olfactory nerve can cause impairment of smell, although the olfactory nerve can regenerate in some instances. Anosmia is the absence of smell, and in phantasmia, also known as olfactory hallucination, the patient detects smells that aren't really there. Many different illnesses can cause damage, such as head trauma, severe sinus infection, and CVA. Nurses can assess for damage by checking the nostrils and conducting a smell test. This is performed by blocking one nostril and asking the patient to smell a pungent odor, such as damp coffee, through the other nostril. Some teaching that the nurse can perform is let the patient know that sense of smell may or may not come back, and that it can also involve sense of taste. The patient may have decreased appetite due to loss of smell, so maintaining calorie intake is important. Conversely, having no sensation could cause the patient to eat more, so ask the patient to keep track of what he or she eats. And also advise the patient to experiment with different seasonings and spices to try to find a way to make food more tasty and flavorful.
I'm going to have you smell this, but what I need you to do is place one finger over one of your nostrils. Okay. Can you smell that?
Why did you put fish to my nose?
That's not fish, it's coffee.
Why did it smell like fish?
Sometimes with a stroke, your sense of smell may or may not be affected. Okay? Alright, the next nerve I'm going to check for is the trigeminal nerve.
The trigeminal nerve is the 5th and largest cranial nerve. It has 3 branches that conduct sensations from the upper, middle, and lower portions of the face, as well as the oral cavity, to the brain. The ophthalmic, or the upper branch, supplies sensation to most of the scalp, forehead, and front of the head. The maxillary, or the middle branch, stimulates the cheek, upper jaw, top lip, teeth, and gums. Mandibular is the lower branch that supplies nerves to the lower jaw, teeth, gums, and bottom lip. A patient who has experienced a stroke may lose sensations in their face if this nerve is affected, or may even lose control of biting, chewing, or swallowing.
Miss Cooper, can you close your eyes for me? Okay, you're having trouble closing your right eye. Can you cover that eye? No, you can't.
I'll help.
Okay. All right. Thank you, Shay. All right. What I'm going to do is I'm going to touch a place on your face, and I need you to tell me what I'm touching, okay? Can you tell me what that is?
My cheek.
Okay. Which cheek?
Right cheek.
All right. Can you feel that?
Uh-uh.
No? Okay. What about that? Okay. All right. Thank you. Ms. Cooper, we're going to go ahead and assess your facial nerve.
The main function of the facial nerve is motor control of the muscles of the facial expressions. To determine damage to the 7th cranial nerve, initially inspect the face during conversation and rest, noting any facial asymmetry, including drooping, sagging, or smoothing of normal facial creases. Ask the patient to raise their eyebrows, to smile, showing their teeth, or to frown, or to puff both their cheeks. Difficulty performing these maneuvers indicates damage to the 7th cranial nerve.
Can you raise your eyebrows for me? Okay. Are you raising your eyebrow? Okay. Can you blow out your cheeks? Next thing that we're going to do is we're going to test the acoustic nerve. So I'm going to have Shay whisper behind you, and you just let me know if you can hear him, okay? Can you hear him?
I can hear him saying something on this side.
Okay.
I can't make out what it is.
All right. Can you hear anything on this side? Nothing? Okay. All right, Miss Cooper, the next nerve I want to assess is the vagus nerve.
Hey, well, you know how they always say that everything in Vegas stays in Vegas. When it comes to the vagus nerve, it doesn't stay anywhere. It likes to wander. So the vagus nerve is actually the 10th nerve in the cranial nerve system. Some people call it nerve X. It's actually 2 cranial nerves. It extends from the brainstem and connects down to the viscera. Sometimes the nerve is referred to as, like I said, cranial nerve X or 10th cranial nerve, the wandering nerve. These nerves are used to send a variety of signals throughout the body, but they'll also transfer signals back to the brain. So the vagus nerve is also known for wandering through the body, weaving through the abdomen down here. I don't know if you can see her, branching into the other nerves that extend throughout the limbs and the organs down in here. But basically what that vagus nerve is kind of like the captain of the ship. The vagus nerve is used to regulate a variety of body functions. It could be your heartbeat, boom, boom, boom. It could be the muscle movements necessary to keep you breathing. And, also the nerve also regulates your chemical levels in your gut, in your digestive system. Without your vagus nerve, you didn't go to the bathroom.
We're going to go ahead and test for the vagus nerve. I'm going to stick this tongue depressor in your mouth, and we're going to see if we can initiate the gag reflex, okay? All right, you ready? All right. I think that works.
Oh, Nancy, aren't there other ways that we can test for this vagus nerve?
Yes, Shay, there are several different ways that you can test for the vagus nerve. Okay, Ms. Cooper, the next nerve that we're going to assess for is the hypoglossal and the
The 9th
glossopharyngeal.
cranial nerve is the glossopharyngeal. It receives sensory information from the tonsils, the pharynx, the middle ear, and the posterior 1/3 of the tongue, which is the area that recognizes sweets. It is responsible for the elevation and opening of the upper pharynx. The gag reflex is one way to assess this nerve. It affects speech production because it affects the shaping of the pharynx into various positions when producing speech sounds. Assessing the sensory functions of the glossopharyngeal nerve can be done by evaluating the taste of sweets on the back of the tongue. Tactile sense in the pharynx is assessed by checking the gag reflex by using light touch and direct inquiry about problems with aspiration, and difficulty swallowing. The 12th cranial nerve is the hypoglossal nerve. It is entirely a motor nerve which controls the tongue muscles. Involuntary function of the tongue includes swallowing saliva. Voluntary function controls speech. A patient with a CVA may present with difficulty swallowing or poor articulation of speech. When assessing the hypoglossal nerve, have the patient stick out their tongue. If affected, it will deviate toward the affected side, or in the case of bilateral damage, the range of motion of the tongue will be reduced. The patient may also appear to be drooling due to inability to clear the mouth of saliva by swallowing.
Ms. Cooper, we're going to go ahead and assess for your glossopharyngeal nerve. Can you take your tongue and move it internally from cheek to cheek? Are you able to do that? No? Okay. All right, we're going to go ahead and assess for your hypoglossal nerve. Can you stick your tongue out for me? Okay, thank you. All right, Miss Cooper, I'm going to go ahead and make some notes about the findings from the assessment. Is there anything else I can do for you before I leave? Okay, we're going to go ahead and get you to lay back and get you comfortable, okay? Thank you for letting me do your assessment. And I'm going to put your call light where you can reach it. And are you thirsty or do you need anything?
I'm going to go get your family. Let them know they can come visit, okay?
Let's get you. Are you
All right, Miss Cooper, I brought your family in to see you. We'll be back in a little while. I'll give you some privacy. You all right? No? What's the matter?
I had a stroke.
Okay, so ocular, we're going to have okay.
You had fun?
All right, so
Okay.
I'm going to have Ms. Cooper, we're going to go ahead and test for the vagus nerve. And what I'm going to do is going to stick this in your mouth, and I'm going to see if you can,
Are you ready? P.U. What's that smell? The olfactory nerve.
Mandibular, the lower branch, supplies nerves.
Cranial nerve number 9 is the the cranial nerve is the Okay.
The facial nerve is the seventh cranial. Let me start all over. To determine damage of the